Barbara walks with a neighbor several mornings a week before work. For the past 6 weeks or so, she has commented on pain across the bottom of her feet. She first notices pain when she awakens, and it worsens with walking. At the same time, she notices pain when holding her coffee cup, gripping her toothbrush, and turning doorknobs. The pain seems to be getting better as the day goes on, and washing dishes in warm or hot water or taking a hot shower feels better. A few times, the pain was so intense, she took some ibuprofen.
So what's been going on?
My hands are so stiff in the morning, I cannot hold my coffee or my toothbrush without pain. Ibuprofen helps some, but my feet really hurt too. My shoes are tight. I feel tired all the time. What is wrong with me?
Is there anyone in your family who has ever had arthritis?
My mother's sister, Aunt Emily, had some kind of arthritis. Her hands were deformed. Is that going to happen to me?
It's good you came in. We'll figure out what's going on and come up with a plan together. Barbara, you have many swollen and tender joints over your wrists, fingers, and a small nodule over your left elbow. Your feet are tender too. I would like to check some blood work and get some x-rays. I may need to send you to an arthritis specialist, but I suspect you may have rheumatoid arthritis.
Oh no. Will I be able to keep working? Will this ever go away? I'd love to try and not take medications if I can help it.
With proper treatment, my goal is for you to continue working. If this is rheumatoid arthritis, which is very likely, there is no cure. However, there are very good medications which can improve your ability to function day to day, reduce pain, and prevent damage to your joints.
What should I eat? Can I exercise?
With inflammatory arthritis, there is an increased risk of heart disease. I recommend a Mediterranean-style diet. You should continue to engage in physical activity as you are able. Movement is good. We may refer you to a physical therapist or occupational therapist who knows about arthritis. Good to see you again, Barbara. Your labs and exams support the diagnosis of rheumatoid arthritis. I'm going to refer you to a rheumatologist, but I'd like to get you started on methotrexate in the meantime while you wait for an appointment.
Isn't that a cancer medication? What are the side effects?
You are right that methotrexate can be used to treat certain cancers, but for arthritis, the dose is much, much lower. Methotrexate can cause inflammation in the liver or lower blood counts. We will check your labs again after you have been on the medicine for 2 to 4 weeks. We'll give you another medicine called folic acid, which helps reduce side effects of mouth sores, low blood counts, or mild fatigue and nausea.
Thank you so much, Dr. General. What else could I be doing so my symptoms don't get worse?
Please stay active with walking or gentle stretching, as that may help with stiffness. Maintain a healthy weight and get sufficient sleep.
Before beginning methotrexate, be sure to 1. Check a CBC, serum creatinine, and aminotransferases. 2. Screen for hepatitis B, hepatitis C, and tuberculosis. 3. Ensure your patient is up to date with standard immunizations. 4. Avoid use of methotrexate with anyone who is pregnant or plans to get pregnant in the next 12 months. 5. Also check a chest radiograph to screen for occult infection or underlying lung disease. There are contraindications to prescribing methotrexate. It can cause birth defects and should not be given to people actively trying to become pregnant, currently pregnant or lactating, or women not using adequate contraception. Do not prescribe methotrexate for patients with known liver disease or who use excessive alcohol. Do not prescribe for patients with a GFR less than 30 milliliters per minute. Begin methotrexate as a single, weekly dose of 10 milligrams orally. Barbara's doctor prescribed 4 tablets once a week, all at once.
I appreciate you for helping me figure this out. I'm really looking forward to feeling better soon.
Of course, Barbara. Feel free to reach out to me if you have any questions before you get in to see a rheumatologist.